Welcome back. I'm Mabel Jong, and you're looking at our last interview of the day here at the Congress in Washington, D.C. Thank you for joining us. I'm here with Matthew Walsh, who is Senior VP, Chief Operating Officer at Health Alliance Plan. Thank you so much.
My pleasure.
Well, tell me what Health Alliance Plan is, first of all, how big it is, and you're already actually owned by a provider organization.
Correct, Mabel. Yeah, HAP, Health Alliance Plan, is owned by Henry Ford Health System. We're about a 650,000 member health plan and we've got a full suite of products. So we have your commercial products, HMO, PPO. We also have Medicare, Medicaid, and we also have a TPA. So really the full suite. We are pluralistic in that we contract with lots of providers to provide the care to our members, not just the Henry Ford Health System. But the Henry Ford Health System does own us and has a very large constituent of our population that they provide care for. Henry Ford Health System is a little bit over $5 billion organization. They have, at this point, 5 community hospitals and a tertiary quaternary center in downtown Detroit. And then they have the Henry Ford Medical Group, which is 1,300 doctors fully employed that admit to the Henry Ford Hospital downtown and also provide some admissions to the other community hospitals. They provide care for about 20% of our members. They are also pluralistic in that they contract with CMS, Blue Cross, and other payers.
And you've recently done another deal with another health plan, is that right?
We have, yes. So February 1st, we merged with Health Plus, which is up in Flint, so just outside of the Tri-County area. They bring to the table about 75,000 members, commercial and Medicare. We had lots of overlapping employer groups, so there was a lot of synergies there. We have a shared history, both formed through union ties. HAP's been around for about 50 years, formed by Walter Reuther, UAW person who started the UAW. And Health Plus has a similar history.
Okay, and for other health plans that are looking to partner up with provider organizations, what is one thing that you've learned being part of that and being as big as you are?
Well, you know, it's interesting because if you go back to the 80s, it became cool to own a health plan if you were a provider organization. And that's about the time the Henry Ford Health System acquired HAP. And then in the 90s, it got kind of uncool, and most provider organizations sold their health plans. Henry Ford didn't, and doubled down. Actually, at that point, we bought another health plan that was for sale by some other health systems, and doubled down on the integrated model, where you provide the insurance and you provide the care. It's now coming back in vogue as we look at value-based health care. And so, you know, we think that this time's different. For a few reasons. I think, you know, one of the challenges we had as a health system over the past 15 years is, even though HAP would be value based for the care that's provided with the health system, the other payers weren't. They were paying fee for service to the providers, and so the providers had a hard time making the investments they needed to make in population health and such, because for 2/3 of their business, they were getting paid fee for service, which doesn't support reduction in utilization.
Right.
We've made that transition through the changes with the ACA and Medicare changes. The Henry Ford Health System is now doing the next-gen ACO for all their Medicare members, and the other payers in the region are also looking to move to value-based. So all of a sudden, the value proposition to make all the investments that need to be made to truly drive down the cost of care exist and create the alignment that we need.
Well, it seems clear that the M&A activity will continue, maybe, you know, perhaps for your own firm, but do you think there are any drawbacks to those two organizations partnering up as one?
The payer-provider? Well, you know, I don't think there are drawbacks. I think it does create complexity, right? I think that particularly in the pluralistic model that we have, you've got lots of hats you have to wear. I always say that my baldness is due to all the different hats I've had to wear over the years. But it is more complex, but I believe that is where the true value can occur, is when you have the payers and the providers working together to drive down the
Sure.
cost of care and improve the quality.
Yeah, it seems to make a lot of sense. What are other messages that you're leaving with attendees at this conference this time?
Well, in my mind, and we just talked about it, it's all about reducing the cost of care. This country cannot continue to support the increased cost of health care and not get the value for it. And I think what you are hearing about through these sessions and everyone I've been in today is how do we get to a different value proposition for the members and the patients that get care through our organizations.
Well, we certainly are talking about it a lot. Have we actually seen anything happen in that direction?
I think you have. I think, certainly what we're hearing today is the different struggles that different organizations are going through, but there's a lot of innovation. I think a big difference now is that there's a lot of data. So the meaningful use work over the past few years has in many cases created for providers a foundational amount of data that they can use to provide care differently. I think the last time around in the 80s, you had HMOs trying to put providers into risk, and the only data they could provide them was claims data, right? And that wasn't enough to really be able to manage care. And now you've got all these provider organizations with EMR data, which is a lot more real time and is a lot more granular in what they have access to, which should enable them to really be able to affect the cost of care.
Thanks for your comments on that. May I ask you, since you have such a busy schedule, how does the World Healthcare Congress make it on your calendar? Why come to this event?
Well, this is a good opportunity that over a couple of days to be able to see what many organizations across the country are doing and the challenges they're facing. In some ways it's therapeutic because it's, you get to hear about a lot of the same things that we face in Detroit. And in a lot of cases you find new ideas that you can bring back and adapt into your environment.
Okay, thank you, Matthew Walsh, for being here today.
My pleasure.
And I thank you. That's our final interview for day one. Join us tomorrow for day two. I'm Mabel Jong. Thanks for watching.